Hello, thank you for joining us for the training and overview of waivers and the alternative care program in Minnesota. In the next couple years, home and community-based services will be evolving and changing as a result of something called Waiver Reimagined. We'll be talking more about that in the next few slides. If you wanted to check out more trainings, you could go to hennepin.us/CMTY support, hennepin.us/community support for topics like guardianship, supported decision making, waiver reimagined, transition services, consumer support grant, family support grant, housing, vocational services, and others. These trainings, as of last month in May, are offered in person and online through YouTube videos. As I mentioned, home and community-based services, the waiver, is evolving and changing. One thing that will remain the same is that medical assistance funded home care services and therapies like personal care tenant services, private duty nursing, home health aides will still be a part of the umbrella or the budget of home and community-based services. Currently, for a couple years until 2024, the waivers will exist like they have before in different categories. One category is for people with developmental disabilities and related conditions. That's called the Developmental Disabilities Waiver, and that focuses on habilitation or teaching, training, educating, challenging the person to be as independent as possible. Another group of waivers are long-term care waivers. There are CAC services, which is community alternative care, which is also hospital level of care. CADI services, which is a waiver that serves people with nursing home level of care, and that is called Community Access for Disability Inclusion, or the Community Access for Disability Inclusion Waiver. We also have the brain injury, or the BI waiver, which is for people that have an acquired brain injury, typically after age 21. Before age 21 is typically considered a developmental disability. For those that are over age 65, there's the Elderly Waiver Program, which is for those that qualify for medical assistance and are over age 65, and the Alternative Care Program, which is for folks that are over age 65 but do not qualify for medical assistance, so that is a state program. In the future, in 2024, through Waiver Reimagined, the plan is to consolidate the 4 long-term care waivers into 2 waivers based on where the person lives. One thing that won't change is that medical assistant funded home care and therapies, again, PCA services, private duty nursing, home health aides would be a part of the umbrella or the budget of the waiver, but then the waivers will be consolidated into one topic, which is services for licensed settings or community residential settings or group homes where the provider generally owns the property and delivers the service. The other category will be for services in your own home, a place that you own or rent and have control of, or in a family setting. So you would have waivers and services that are focused on supporting you in your own home or a family setting. Waiver Reimagine, some simple goals are that it will streamline services and hopefully make things less complicated through a simpler menu of services. They'll be grouped by where the person lives versus their disability. And also there'd be an individualized budget based on the individual through an individualized assessment. The timeline for the project so far, basically in 2017, the legislature in Minnesota required the Department of Human Services to conduct 2 studies to identify improvements to waiver programs for people with disabilities. Between 2017 and 2018, the Department of Human Services conducted extensive research and stakeholder engagement meetings that informed Waiver Reimagined legislative report and recommendations, and made recommendations to how to improve waiver services. In 2019, the legislature authorized Department of Human Services to simplify the service menu and to continue analysis and research to reshape the waiver programs and individualized budget. Around 2020, Department of Human Services developed policies, procedures, and systems to implement the specified services menu, which began January 2021, where some of the services were consolidated as well. Department of Human Services continued to conduct research and had extensive stakeholder engagement on reshaping the waivers and talking about individualized budgets and self-direction. Phase 1 implementation began in 2021. Changes to simplify the services menu took effect in January 2021. Again, some of the services were consolidated. We'll talk a little bit more about that in a bit. And the Department of Human Services recommended policies to reshape the waiver programs and implement individual budgets to the 2021 legislature. 2022 and beyond that, after approval from the legislature, the Department of Human Services will submit a plan for federal approval to reshape the waiver programs and individualized budgets. Implementation will begin in 2023 or later, whenever the federal government approves the changes. Here's some examples of how the Waiver Reimagine simplifies the waiver service menus. Some services that exist now, January 2021, like corporate foster care and supported living services, or SLS corporate, or typically group homes or community residential settings, will just be called community residential settings. Instead of being called corporate foster care or supported living services, they'll be called CRS, or community residential settings. Other services like family foster care and supported living service family will be called family residential services. Other services like personal support and adult companion that existed before 2021 will be called individualized home supports without training, again consolidating a group. Independent living skills training, individualized home supports, supported living services, 15-minute units will be called individualized home supports with training. So they'd be more comprehensive and more training for the staff would be required, versus individualized home supports without training is more about support and supervision in the community. In-home family supports, which is typically services hourly or daily in the family's home, will be called individual home supports with family training. And finally, day training and habilitation and structured day program would be called day support services instead of day training and habilitation. DT&H, day training and habilitation, would go away for the most part and become day support services. Another change through Waiver Reimagine is tiered services. Tiered services means that the service setting has a higher standard for new people authorized to receive the service. The new tiered standards meet the home and community-based rule regulations for more fully and support community inclusive service models for people with disabilities. In February 12, 2019, the Centers for Medicaid and Medicare Services, CMS, approved Minnesota's statewide waiver transition plan to bring settings into compliance with the federal home and community-based waiver rule regulations. Minnesota's statewide transition plan includes a plan to implement higher standards for new people, or tiered standards, for several services. The Department of Human Services submitted waiver plan amendments to the CMS, the federal government, to implement the home and community-based rule tiered standards on September 2020. The CMS federal government approved the Minnesota Department of Human Services brain injury, CADI, and developmental disability waiver amendment packages January 2021. A couple more changes and additional amendments. Customized living will add tiered services. Adult day and family adult day services will add tiered services. Pre-vocational services will be add tier standards, and integrated community supports is a brand new service that was introduced in 2021. We'll talk a little bit more about that as well, where the provider owns an apartment building as an example. People live within the apartment building, receive services from that waiver vendor who also owns a property. People have choices to have housemates or not have a housemate, and that housemate doesn't have to participate in the services, or they can participate in the services. So a little bit more about medical assistance, home care, and long-term care programs. They provide services that enable people with disabilities with a variety of needs to remain in the community to achieve the highest level of independence and participation desired and possible. Some examples of home care services are skilled nursing visits, private duty nursing, a home health aide, personal care attendant or personal care assistant, and the supervision of the PCA or the personal care assistant. Some home care therapies are physical therapy, occupational therapy, speech and language pathology, respiratory therapy. These are offered through medical assistants, and if they meet a cap or a threshold and they couldn't be offered through medical assistance anymore, they could be offered through the home and community-based waiver as a waiver service extended into the person's budget. Here's an overview of the waivers again that we have today. For those under age 65, we have the developmental disabilities waiver. It's an intermediate care facility level of care. The CADI waiver, community access for disability inclusion waiver, nursing home level of care. The CAC waiver for alternative care, hospital level of care. The brain injury waiver is nursing home or neurobehavioral level of care. And for those age 65 and older, there's the elderly waiver and the alternative care program. In the 80s, before the 80s, the only option we had were nursing homes and regional treatment centers where people with disabilities could live outside of the family home and getting natural supports. In the 80s, different home and community-based waivers began being developed. The developmental disabilities waiver, the CAC waiver, the CADI waiver, the brain injury waiver, all in the 80s. So we had some more options for people. They tended to still be larger facilities in the community, and eventually they were downsized to smaller facilities. One of the first steps to get a waiver is to ask the county for a min choices assessment. This is a standard assessment across Minnesota, and it's person-centered, completed by the county nurse or social worker. It has a number of questions that that expand or delve into a person's needs for support, and the services are based on the person's needs as identified in the min choices assessment. A determination is made regarding which program is best. A final authorization is from the Minnesota Department of Human Services. But again, a first step is to call the county to ask for a min choices assessment to determine what services you might qualify for. A quick review, the levels of care currently for the waiver are intermediate care facility for people with developmental disabilities and related conditions, hospital level of care for people on the CAC waiver, community alternative care, nursing home level of care for people on the CADI waiver, and for people on the brain injury waiver, they have two levels, nursing home level of care and neurobehavioral level of care if they have a higher level of need. When you are going through the process of getting an assessment, the services, you want to think about what services are necessary to ensure the person's health and safety and welfare. Also think about the person's desires, needs, and preferences, and can the services be provided by any other funding source? And are they cost effective and reasonable? We're going to talk about the CADI waiver first, Community Access for Disability Inclusions waiver. One nice thing is that all the waivers have the same services, so I'll go into detail regarding one waiver, and the other waivers are almost identical regarding the services they offer currently. That will make it easier to collapse them. So a consideration, they have to be eligible for medical assistance. They have to be certified disabled either by being open to Social Security or completing the state medical review program or being SMRTed. To start the SMRT process, To determine your level of disability, you start with the county, and it will be done by the state of Minnesota, but the county administers the process. For the waivers we're going to talk about first, you have to be under age 65. You need nursing home level of care for the CADI waiver. You need supports and services over what straight medical assistance state plan could cover. So state plan could cover PCA services, personal care attendant services. If you need services over and above that level, you might qualify for a home and community-based waiver. This is a lot of services. We're going to talk about each service a little bit in detail first, and then we're going to review the other waivers, and we'll provide a quick overview coming up because the services are similar with other waivers. So 24-hour emergency assistance. It's a plan of care. It could be a live-in person. It could be a person in a neighborhood that's available to be on call. It's overnight supervision, either awake or sleeping. We have adult daycare for adults, a place for them to go for meaningful activity, an adult daycare bath for an option for people if they don't have an accessible bathtub or bathroom at home. They could have a bath in the day program instead. Case management is included as a part of the waiver. There's an option or service called customized living and customized living 24 hours. Customized living is a program that generally has services in the building. They might have occupational therapy, physical therapy, nursing in the building. You're provided meals in the building. You can either eat in a group in a congregate setting, or the meals could be brought to your apartment. You have an apartment with a bedroom and a kitchen and a bathroom, and it could be 24 hours a day. You kind of purchase services off a menu. If you need med administration, that's a certain cost. If you need help with podiatry, that's a certain cost. If you need help with cleaning your apartment, that's a certain cost as well. Consumer-directed community support, I'm going to leave till the last because it's quite comprehensive and a very different service. Through the CADI waiver, you can also get crisis respite services. It's a very expensive service where there are crisis beds in the metro area that a person could go for a time limit at a time while you're maybe enhancing your budget or building a fence or training staff at home because the person is in a behavioral crisis. There's extended home care therapies. I mentioned that home care services, private duty nursing, home health aid, PCA services are home care services. If you meet a cap or a limit or need more services than what they are assessed at, you can extend them through the waiver and they become waivered services. Employment services dropped day training and habilitation services, and they added 3 services: employment development, employment engagement, and employment support. So these services help to have a person maybe go through a process of discovery to determine what they really enjoy, what they like to do, where their skills are, and they look for a job through the development process, and they support the person on the job like a job coach through the support element. A case manager would develop a schedule on a regular basis to determine which of these services the person is using daily and weekly. Family training, education, and counseling is an option. Family training, education, and counseling can be used to provide training to the family in a certain area of disability. It can be used to fund person-centered planning, to have a facilitator and a graphic recorder to go through the person-centered planning process. And so that can be very helpful. Family residential services, the new word for them, the old word was family foster care. The new word through Waiver Reimagine is family residential services. Could be in a family's home. The family is certified through family residential services to provide care, and they can have additional services beyond this. Home delivered meals are an option. 1 meal a day for 7 days through many programs that are certified to deliver home delivered meals. Some meals are local and they come every day from a kitchen in the neighborhood. Other meals would come fresh, delivered once a week. Other meals would come frozen, generally from other parts of the United States outside of Minnesota, and you would just keep them in your freezer and warm them up in the microwave. That's for people that would have difficulty using the stove or cooking or keeping track of the time the oven has to be on or things like that. Homemaking services. So helping a person to organize their home, to clean their home, could be an option through the waiver. Independent living skills therapies, helping people to be more independent, to learn skills about living on their own, to learn basic skills to be more independent versus to relying on others. Integrated community supports is a new service that is an option where the provider owns a building, apartment building, and people live within that apartment building, and they're offered one-to-one funding for a period of time. And they can have housemates, and they can choose to have that. The housemate can choose to be a part of the program or just be independently living in that building. Home modifications and adaptations. So if you need a ramp to your house, grab bars in the bathroom, a mini elevator, a mini vader in your house. If you need to expand the size of the bathroom because the wheelchair doesn't fit in the current bathroom you have, we can spend up to $40,000 beyond your budget to modify a van, to raise the roof or lower the floor, add a ramp, add batteries and other things, adaptations and modifications to your home. Night supervision can be an option. A staff that's there at night to help and assist you. Positive support services, used to be called behavioral support services, now they're called positive support services, can be an option. Pre-vocational services is a tiered service helping to teach people to work, teach people what work is, teach people routines, those type of things. Respite is a break for the primary caregiver, where the primary caregiver goes out of the home for a period of time and somebody comes into the home to provide a break, or the person goes out of the home and the care provider stays in the house and the person goes out to another family or to another program for a couple hours or a day or a week, as an example. Specialized equipment and supplies, including personal response systems. So specialized equipment that's directly related to the person's disability, that's modified or adaptive, can be paid, and personal response systems, which would be a button that you push and it would call somebody, or would call an emergency response unit to come and help you out. Many of the services include transportation as part of the rate, but also there's a transportation service. And so it could be mileage offered to the staff person, or it could be a trip paid per trip. So much per trip or so much per mile. Transition services are another option if you move from a community residential setting to your own home. If you move from a residential setting or a hospital to your own home, money can be used for moving expenses and limited kinds of furniture related to your disability as well. All of these services are listed on the state of Minnesota's website, so you can look them up, and there's a whole page description about each of the services to give you more detail. The next reviews will be a little bit easier because the services are the same for each of the waivers we're going to talk about. So we have the brain injury waiver. People need to be eligible for medical assistance. They have to be certified disabled. They have to be under age 65. They have to be diagnosed with an acquired brain injury, which means it didn't happen at birth or it didn't happen before age 21. It happened after age 21. They're able to participate in rehabilitation. So they have to be able to participate. They have to be able to engage in rehabilitation. They either need nursing facility or neurobehavioral hospital level of care, so 2 levels of care for the brain injury waiver. And they need the supports and services only available through the brain injury waiver and not through cognitive behavioral impairment. So they need to look at those services specifically. And the services through the brain injury waiver are the same ones we talked about with the CADI waiver, except that the brain injury waiver level of care is nursing home and neurobehavioral hospital level of care. The developmental disabilities waiver its level of care is a place called an intermediate care facility for people with developmental disabilities and related conditions. An intermediate care facility is more of an institutional setting which requires nursing and a dietitian. The dietitian creates the menus. The menus might be 4 ounces of protein, a half a cup of vegetables, a half a cup of starch. They have to have a fire drill every month, sometimes in the middle of the night, sometimes during the day. They have to have many meaningful goals and objectives. They have to have active treatment regularly. And so that's where we get the institutional kind of aspect of the intermediate care facility. People on the developmental disabilities waiver need to have the supports and services over what medical assistance state plan covers. They're diagnosed with a developmental disability or related condition. They require daily intervention or 24-hour plan of care. They make an informed choice of waivered services versus intermediate care facilities for people with developmental disability. The developmental disability waiver services are the same. The difference is the focus is habilitation for now. After 2024, that component of habilitation will go away. It'll be sunsetted. But until 2024, it includes the same services as a CADI and the brain injury waiver. But habilitation means services which teach, train, educate the person to be more independent and learn new skills. So they must have at least one of the following services. They must have at least one of individualized home supports with training, individualized home supports with family training, community residential services, family residential services, or consumer-directed community support. There are situations where they might not have the service, but they have respite or homemaker, but you justify it that the primary caregiver is providing the habilitation service on their non-paid time. So they're being paid for respite or homemaker services, but the primary staff person is teaching, training, educating them on their non-paid time. So they must have at least one of these services, not all of them, just one of them, to meet the habilitation component at least through 2024. Community alternative care, or the CAC waiver. So imagine that you're living at home with your parents and you have hospital level of care, so you need nursing 24 hours a day, 7 days a week. You're eligible for medical assistance, you're certified disabled, you're under age 65, you need hospital level of care. And the primary doctor that you have, the physician, certifies that level of care. You also need visits from your case manager more regularly to make sure that things are going okay. And you need the supports and services over what straight medical assistance would plan, that you need waiver services. Community alternative care waivered services are the same as the CADI, the brain injury and the developmental disabilities waiver. The CAC is for hospital level of care. When you are a person that's nearing age 65 and you're open to a waiver, it's important that you have informed choices, that you understand you could continue the waiver you're on, or you could move to the elderly waiver or the alternative care program. The elderly waiver is a waiver program that's funded through medical assistance, and the alternative care program is not funded through medical assistance. It's funded through the state of Minnesota Department of Human Services. It's sponsored by them to help keep people in the home and prevent them from going to a nursing home if possible. If you didn't have informed choice at age 64 and a half before you became age 65, then you'd probably just go to the elderly waiver or alternative care program, and you wouldn't have a choice of using the typical waivers you were on before, the DD waiver, the CAC waiver, the CADI waiver, because you were already over age 65. So it's important to get informed choice about the levels of care and the waivers before you turn 65. So I said I was going to save this till last. Consumer-directed community support is a service of all the waivers that we talked about so far. It's not a specific, its own waiver. It's a service of all the waivers. It's flexible. It's the most flexible service across the service and all the waivers and the alternative care program. The person has more control of the funds because they are the employer. Instead of having a waiver agency employ the staff and deliver the services through them, you become the employer of your staff. Through a financial management service, you are the employer. That's kind of hard to think of. It's very different, but you are the employer. You develop a plan tailored within a state set budget to meet your needs. You can use community supports and traditional license waiver services. You can create job descriptions and create positions that are unique to you with unique job descriptions, or you can use state set traditional waiver services. It allows a person to be the employer. You set the rate within guidelines or a range, and you determine the work schedule. You are the boss. You hire the staff, you train the staff, you supervise the staff, you set this, the rate of pay, and you are the manager of all your services. Training is required as a part of being on consumer-directed community support through the county. If you're interested in this program, talk to your case manager or talk to the assessor, and they can make a referral for this program. When they make a referral, they'll be asked to give you your traditional license budget and your estimated consumer-directed community support budget, or the budget if it's available. So talking a little bit more about consumer-directed community support, this is a way to kind of explain it. If you have a favorite restaurant, say it's Perkins, think of traditional services. You go to Perkins and what do you expect? You expect breakfast, you expect muffins, you expect cookies, you expect a standard menu of services across the state of Minnesota, a standard menu of food. In Moorhead, Minneapolis, or Worthington, Minnesota, you have the standard menu. There's a granny omelet at all the Perkins. There are poached eggs at all the Perkins. So like traditional license waiver services we've been talking about so far, the provider sets the rate, the provider writes the plan, they train the staff, they hire the staff, they help develop the health and safety plan, they provide only traditional license services, and the county approves the plan. So if you went into Perkins and you started to go in the kitchen to start cooking, you'd get in trouble. You'd be asked to leave. What are you doing in the kitchen? We are supposed to provide the services. We're supposed to bring you the food. We're supposed to bring you the coffee and the menu, which is different than consumer-directed community support. With consumer-directed community support, you are, in essence, making the food, making the meal. You are the person who sets the rate within a range. Currently, the range is about $15.25 on the low end to around $19 on the maximum PCA rate on the high end. It could be more based on the skills, the training, the experience that the person brings, or their position. If they're a nurse or a specialist, they could be paid more. You write the plan, you train the staff, you hire the staff, you develop the health and safety plan, you select generic community supports or traditional services. The county approves the plan, just like with traditional license services. But it's very different because you are there, you're very involved in the process. It's very self-directed. You use a financial management service, a provider that will do the payroll for you, that will help you develop a relationship with the Department of Labor, that will act as a liaison between the Department of Labor and yourself. So those are good things. You can hire people called a support planner to help you write your plan as well. But think of a grocery store where you're picking things off the shelf that are related to the person's disability, versus a traditional service, which is more like a restaurant where the waiters and waitress staff are providing you the service. These services are only available through consumer-directed community support, paying parents of minors and spouses. If you're the parent of a child less than 18, you can provide care for that child. Or if you're a husband or a wife providing care for a husband or a wife with a disability, you can provide care for that husband or wife up to 40 hours a week per household. So no more than 40 per week per household, but you're going to be paid to provide care. Other things, behavioral supports are included in the budget. and also augmentative therapies like music therapy, horseback riding therapy, art therapy, massage therapy, and other non-experimental therapies are all included within the budget, as well as special prescribed diet. So the special prescribed diet might be gluten-free, casein-free, ketogenic, hypoglycemic diet, control protein, low cholesterol. Those are a few of the diets. We pay the difference according to a chart based on your age and the liberal food plan of what a typical person would eat. We pay a percentage. A common percentage might be 25%. So if you're 14 years old and you're on a gluten-free diet, we might give you around $80 so that you can buy gluten-free bread, which is $7 a loaf versus $2 or $3 or $4 a loaf. We pay you the difference between the prescribed items and special items versus the other items that are typical. There's an asterisk at the back of many of these. Special prescribed diet, behavioral sports, and augmentative therapies, they all require a prescription from a doctor currently enrolled in the state medical assistance plan or completion of a form called the alternative treatment form, where the doctor signs off to let you know that it's not experimental in their eyes. Beyond 2024. So we talked about Waiver Reimagine, and Waiver Reimagine is changing the way waiver services are delivered. The Minnesota Department of Human Services plans to discontinue the name Consumer-Directed Community Support in the future, and at that time, all waiver services will have an option to have traditional licensed services within their budget or self-directed services, pending federal approval. So the name will change from Consumer-Directed Community Support to Self-Directed Services. There'll be less of a line between the services, and people will have an option to have self-directed services within their budget. So that will be something that's planned for the future that we haven't seen yet. If you'd like to know more about home and community-based waivers, you might want to try Googling Minnesota Department of Human Services and the typical waiver that you're looking for that we listed earlier. You could also Google Department of Human Services Community-Based Program Manual. The Minnesota Community-Based Program Manual will list each of the services specifically, give you a legal reference, and a detailed instruction or description of each of the services. If you'd like to attend other trainings, feel free to access our website at hennepin.us/CMTYSUPPORT for other topics. Thank you for being with us today. I hope that you received information you were looking for.